Hello, everyone. My name is Cindy Logan. I'm one of the science librarians here at Hale Library. My area of focus as a science librarian is the health sciences. So a lot of the programs that are in the College of Health and Human Sciences, such as athletic training, communication sciences and disorders, the physician assistant program, just to name a few, but there are many more. And today I'd like to talk to you about evidence-based practice. You may hear it referred to as evidence-based medicine. They're sometimes used interchangeably, but if you think of practice as something that you rehearse and do so you can become better at it when you're professional. So we're practicing evidence-based practice. So when you graduate and are in your professional career, you can practice evidence-based medicine. So you'll notice as you are looking at professional programs that quite often you will need to take an evidence-based practice class. And what I want to talk to you today is why is that? Why are they requiring this evidence-based practice class? So I want to start out with a definition of what is evidence-based practice. So this is a textbook definition, so I'm going to read it off of my notes. It is the conscientious use of current best evidence in making decisions about patient care, and it will integrate clinical expertise, patient values, and the best available research evidence. So again, we're looking at the best evidence that is possibly out there to make our decisions or make your decisions. And it's a three-pronged approach with that best available evidence, that clinical evidence that we find in PubMed as well as other professional databases and resources. We're also including your clinical expertise, so the knowledge you have acquired in school and throughout your life on being able to provide your health services to your client, and also those client or patient values. There are some religions that don't allow for blood transfusions. So if you have a patient that belongs to that line of thinking or preferences, you need to take that into consideration when you are thinking of a treatment plan, or perhaps even a lot of things now is cost, because sometimes people cannot afford the medicine or the treatment that you would like to give them. So you need to take into their concerns of cost and find the best possible treatment for them with that. So why is EBEP, evidence-based practice, in professional schools? So there's kind of like four things that I'm going to talk about with that. One, and is the primary goal for anybody in the health profession, I think, is that it is improved patient care, right? You want your patient to get the best possible care, make the best possible decisions for them. And you can do that by looking at the evidence, the clinical research to determine what is the most effective treatment. Besides improving patient care, we also want our health science professionals to stay current with information. A question I'm getting a lot of time when I'm helping with research papers or something of the similar nature is, how far back should I research? Well, it really is going to depend on how new or how current the treatment you're looking at. But certainly if you think about it, the advancements that we have made in medicine, if you're researching cancer, we don't want you looking at something that's 20 years old. And very similar then, we want you to do your research with the most current stuff to be able to make the best possible the best possible decision for your patient. Also, using evidence-based practice will increase your professional credibility. Your colleagues will know that you stay up to date with reading the current research that is coming out or going to conferences. You are doing what you can to not only increase your clinical expertise, but you are staying current to be able to use and the knowledge of the current research that is being out there. You will find that your professional relationships are some of the most important relationships that you will make. And it's very important that you start out with a strong, good professional reputation. And kind of the last thing that we really like evidence-based practice to do is it supports your lifelong learning. All of these steps that you're doing are going to help you as your professional and as you continue on through your career. So it was using those building blocks of what you're learning here in college, and then building on that to make you a good consumer of information as you go out into your practice and expand what you're doing and that type of thing. So how is evidence-based practice used in the profession, right? We're taking this class in college. Now, how are we going to use it? Well, the first few steps of evidence-based practice is developing a clinical question that's usually around a PICO, which broken down is a population with an intervention and a comparison and an outcome. And we're not going to get into that right now, the whole detail of that, but just know that practicing that evidence-based practice starts with a good clinical question. Something like, what is the best treatment for women of childbearing years to become pregnant? Something like that, that you're wanting to assist a patient with who is coming in to see you. And also another element of evidence-based practice, what you're going to learn in that class, is how to really find and appraise that evidence. Now, we talked, or there's many different resources out there, one of them being PubMed, which you will hopefully have explored by now or will soon, but also appraising it. How good is that quality of information? How was that study done? Was there blinding in that study? What kind of study type did it? Was it a case study? Was it a randomized clinical trial? And I understand these may all be new terms to you, and don't worry about them, but just know these are elements that we're going to teach you in an evidence-based class that will be very important for you when you come to appraise that evidence. And then, of course, we're going to help you take that evidence and integrate it into your patient. See how it's going to fit in your particular scenario with your patient in order to give the patient the best possible outcome. Again, the reason for practicing evidence-based practice and evidence-based medicine. So there's a multitude of things that will come together, and why evidence-based practice is going to be taught in your professional schools. It is just what we build on when we are in the health professions, is relying on the knowledge of our healthcare professionals, the current research, the clinical expertise found in the articles, and then our patient values. And we want to give every health profession student the key and the guidance on how to do that, not only efficiently, but quickly, and so that you will be successful when you are practicing. Thanks for listening today. We'll see you again on another day.